So today we're going to talk about a little known supplement that controls blood sugar. Can you guess what it is? Berberine. So berberine is one of the few supplements that is as effective as a drug. And we're going to talk about some of the studies that show that. Now, the problem in the United States, we know, is diabetes, right? 1 in 10 Americans have diabetes. And about 1 in 5 people with diabetes don't even know that they have it. And we know that 1 in 3 Americans, that's huge, has prediabetes. And 8 out of 10 adults with prediabetes don't even know they have it. Now, if you missed my last video on labs you need to check for your annual checkup, be sure to check it, because we don't want you to be one of those people that have missed one of these really terrible chronic diseases. So I'm Dr. Julie McLaughlin, a functional medicine doc for more than 30 years. And today we're going to talk about the top 5 things that berberine can do to help improve your health. So number 1, blood sugar. Many studies have shown that berberine can significantly reduce your blood sugar levels in people with type 2 diabetes. In fact, the effectiveness is compared to the popular diabetes drug metformin or glucophage, right? And it seems to work on a bunch of different mechanisms. It decreases insulin resistance. It's making the blood sugar lowering hormone insulin more effective. It increases glycolysis, or it helps break down the sugar inside your cells. It decreases the sugar production in your liver, and it slows down the carbohydrate intake in your gut. All of those things help lower the blood sugar. And one of the studies, there were 116 diabetic patients, and they took 1 gram of berberine a day, and it lowered their fasting blood sugar by 20%, right? That's huge. That's really huge. And then another study showed that the hemoglobin A1C, remember that's a 3-month blood sugar marker, it decreased by 12%. And it also improved the blood lipids like cholesterol and triglycerides. There was a big review of 14 studies, and berberine is effective as the oral diabetes medicine, metformin and glipizide. So that number 1 that berberine does is huge, right? So let's look at number 2. So if it's controlling blood sugar, what else is it going to control? Weight loss. It's a super effective supplement for weight loss. And there's 2 studies that show it. In a 12-week study in obese individuals, they took 500 milligrams of berberine 3 times a day, and it caused them to lose 5 pounds. 5 pounds in 12 weeks, and they didn't change anything else. The average participant lost about 3.6% of the body fat, which is awesome, right? And then in a more impressive study, it was conducted with 37 men and women with metabolic syndrome. And remember, that's high cholesterol, high triglycerides, high blood sugar, obese, increased waistline. So in this study, it went for 3 months, and the participants took 300 milligrams of berberine 3 times a day. They dropped their BMI, their body mass index, from 31.5%, which is in the obese range, down to 27.4%, which is in the overweight range. And that was in 3 months. So they also lost belly fat and improved other health markers. So number 3, it lowers cholesterol. So a review of about 11 studies, the total cholesterol dropped 24 points after taking berberine, 25 points for the LDLs, or the bad cholesterol. It lowered the triglycerides by 44 points, and it raised the HDLs by 2 points. HDL is a good cholesterol, so we want those to go up, and all the bad ones went down. And remember, when we talked about, if you watched the other video about the apoprotein B and the apoprotein A1, those are the deep dive important markers for cholesterol. Those also lowered by 13 to 15% after taking berberine, right? So this thing is really amazing. Okay, number 4, it has antioxidant and anti-inflammatory effects. It's been shown very effective for these type of things. And it's also, number 5, an antimicrobial. And it's helpful to fight things like funguses, parasites, any kind of other bacteria, viruses. So it really helps kill those off. Now, those are the top 5 amazing things about berberine. So what's the dose? How much should it take? I know you're wondering, right? So it's common to take about 500 milligrams 3 times a day before a meal, half hour before a meal on an empty stomach. So you can take a total of 1,500 milligrams a day. So in our supplement store, we have a few custom pharmaceutical grade packs where we have combined berberine with a couple other key nutrients together for certain types of conditions. We have a blood sugar pack. It has berberine and a few other things, and the metabolic support pack, as well as the tiger pack. If you follow me about our ApoE genetic link, we know that tigers have a tendency for diabetes. So those are our 3 packs. Check them out on the store. I'll put in the link below. Now, a few warnings: if you have a medical conditions or on any medications, it's recommended you speak to your doctor before starting this. And it's especially important to know if you're taking current blood sugar lowering medications. You want your doctor to be able to monitor it. You can take these 2 things together, but you have to be monitored. And overall, berberine has an outstanding safety profile. The main effects that you may have a side effect from could be related to digestion, some cramping, diarrhea, a little gas, constipation, and don't take it if you're pregnant. But overall, this is a superstar, a supplement. If you're looking at controlling your weight, your blood sugar, your cholesterol, metabolic syndrome, and any kind of little antimicrobials that might be lurking around. So check it out, and I will be seeing you next time. Dr. Julie McLaughlin from McLaughlin Care. Bye-bye.